Hi, my name is Dr. Alex Haynes, and today we're going to be discussing erectile dysfunction and men's sexual health in general.
What chronic health conditions contribute to erectile dysfunction?
So chronic health conditions that contribute to erectile dysfunction. 1. Diabetes, through the damage to your blood vessels and your decreased secretion of nitric oxide. Another thing, hypertension. A lot of the health conditions that you'll see that lead to erectile dysfunction are health conditions that damage your vasculature in your body, so your vascular supply. So diabetes directly damages your arteries. Hypertension, things like dyslipidemia, which is a problem with too much bad cholesterol in your blood, can lead to damaging and plaque development in your arteries and your blood system, which will in the long term lead to blockages in a lot of your core arteries, but also the decreased secretion and release of nitric oxide. A big problem as well that people don't know about is something called obstructive sleep apnea. So obstructive sleep apnea often occurs in patients with like morbid obesity, but there can be which leads to increased soft tissue in your upper airway. So what happens is when one sleeps, these soft tissues start to obstruct your airway pathway. So these patients will sleep for a while, they will get into a deep sleep state and then stop breathing for a period of time and then wake up. So what happens here is a multifactorial thing with obstructive sleep apnea. One being that your sleep cycle is completely off. You're going to wake up in the morning feeling more tired than when you went to sleep. You're going to have decreased attention. You're going to feel chronically fatigued. Now, we spoke about the importance of a healthy sleep cycle in terms of reducing your stress and increasing your testosterone levels and decreasing your cortisol levels, which are all necessary for achievement of a healthy and sustainable erection. But chronic sleep apnea also decreases the levels of nitric oxide by this impairment of breathing while you're sleeping, which also leads to the problems of erectile dysfunction. So psychological conditions. I think it's very important to speak about conditions such as depression and anxiety, which can have a direct effect on one's not only mood and libido, but the desire to achieve erection and the physical possibility. Also, chronic medications that you're on. If you are having any chronic diseases, things like heart medication, actually that you use to decrease your high blood pressure, such as beta blockers, can decrease your efficiency of erections. Antidepressants it's a catch-22 kind of double-edged sword, because depression can lead to levels of depression can lead to problems with like achieving and maintaining erection, and you would want to treat that with the antidepressant, but sometimes the side effect is erectile dysfunction, or actually the problem with reaching climax. Common medicines such as antihypertensives, anti-Parkinson medicine, diuretics, antipsychotics, and medicines for anti-epileptics such as Epilim and like sodium valproate. It depends. It can be a multifactorial reason why you're having erectile dysfunction. If you're not being able to, if you're treating an underlying cause of a condition that might not be related to erectile dysfunction at all, sometimes the medicines that you're on can have a direct effect on like achieving and maintaining erection.